must be loads of questions, because it's not just a question of feeling the emotion. It's how do you convert that emotion into service quality for people with dementia. So David is here. This is your opportunity. Do ask questions. Don't be shy. We're very...
My name's Gareth, but as a bloke from Essex, I'm going to have to work on this feeling malarkey. Two questions. First, about staff uniform. Always been really sympathetic to this idea, really loved it. Whenever we try to tentatively go that way with the nurses and carers, we always get, one of the issues has been raised in terms of the residents actually having trouble with personal care and not recognising the individual and getting agitated by the individual that's actually giving that care. They don't actually recognise who they are. So it's not trying to come from the institutional manner, but as a way. And I wondered what your experience has been with that, because it looks so good like that. It's like, oh, I want some of that. So that was number one. And then secondly, more on a sort of, sorry to bring it onto a more of a commercial footing, but in terms of the best care homes that you've seen running things like that, what's the staff ratios that are actually in place there? Yeah, in terms of, you know, is it 1 to 5 or 1 to 8, or whatever it is in terms of care and nurse ratios? Just interested in both those, please.
Okay, I'm sure there are questions other people would want me to answer as well. And I'm not saying it in a critical way, but can I just say, isn't it fascinating, after an hour and a half of that presentation, and this always happens, that the uniform is the first question always. And I'm not blaming it, because the fact it is, it shows it's still a statement of where we are. That's the first thing we want to talk about out of a massive presentation like that. But it is an indication of, as you say, of where the sector still is. What I would say is that services that come up with all sorts of reasons around not getting rid of the uniform are because they're not getting it. They come up with reasons like, well, people with dementia won't know who's who. Yes, they do. It's just they don't know at the moment because you're wearing the uniform. But eventually, they will recognise your eyes. They'll recognise something about your face. They'll recognise you're the safe person for them. That's the sort of thing we want to create. And so the need for the uniform diminishes and diminishes in direct proportion to how much you get this culture and how successful you are at it. But I take your point, and I would say even in those homes you saw, there would be 1 or 2 spare uniforms still in a locker somewhere for the one person who does need it put on. In other words, it becomes a person-centered approach to the 1 or 2 people out of 40 who do need the uniform to feel reassured that it's a nurse providing the care, but that the other 38 never need it. So again, it's not an all or nothing. It's a culture of know them and us. But when it's needed for good reason, then I've seen I've had a home where I said, put one on and try. So that's my first thing. Second thing, a really good question about ratios, because Dementia Care Matters doesn't work with any home with a worse staffing ratio than 1 to 5. So all 54 project homes have a 1 to 5 staffing ratio or better. Is that enough of an answer?
Yeah, I mean, and that is fundamental really from a commissioning point. So for the commissioners and fee rates, unfortunately, that's based on 1 to 8 and 1 to 10.
Then I'm happy.
Then it doesn't lend itself.
So can I say to that if services have got ratios 1 to 8 to 1 to 10, then as long as commissioners are prepared to say we are not providing person-centred services, we are not providing relationship-focused services because we can't afford them, then then deliver the 1 to 8, 1 to 10, and I'll accept the costing. But I abhor the hypocrisy of actually saying that we're following the whole health and social care agenda of person-centredness with a ratio that's setting the staff up to fail.
No, I agree.
Just to follow up on the question on uniforms, What I would like to ask is there documented evidence on how the impact of not wearing uniform is having on people with dementia? Because I would like to go that route as well, but to do that I would need some evidence that I can pull on and say this has been done here, this is the outcome, and could we give it a go?
Isn't it fascinating we're still stuck on this? And isn't it fascinating that you want evidence? Have you not just, is that not evidence? Does that not hold up as research evidence? I'm not deliberately being facetious. I'm really saying, who holds the power here? Who decides? You know, is it us? Is it senior managers? Is it not people with dementia who decide? Try a day without it. Yes, go to contact any of the 54 homes on our website. Ask them for the evidence. I suppose I'm worried about this whole climate that says we want evidence to take away the asylum culture. It's quite strange. It's like we've gone into some weird universe. And I'm not saying it as a criticism of you. I'm saying that's part of the problem of culture change, that we're so stuck.
Hello, and thank you, very inspiring. We spoke about culture change and about the positive interaction between the service user and the carer. It seems to be that we require staff to move towards selflessness. Do you have any basic ideas on how we can encourage that in everyday practice? How we can move away from bureaucratic delivery towards giving of the self in that caregiving relationship?
Yeah, I mean that's why I believe that dementia care training doesn't start on dementia, and doesn't start on people with dementia, it starts in ourselves. That actually if you're going to understand the journey that someone with dementia is going to go on, you have to have also, first of all, understood your own journey in life. And a lot of people don't, either because they haven't had the help in life or the support or the resources. And yet most people in life have their story and have had their emotional journey through their own life. And I think what it's about doing is saying that it's helping staff to see the connection. People confuse some of my, when I say, there's a danger when I present like this, that people think I'm saying, oh, we're going to all share our stuff and it's going to be all, no, that isn't it. It's not about this mass emotional tsunami that managers are very frightened of and think, well, how am I going to manage that if we unleash all that in the staff? It's like, no, you're not going to unleash it all. A, it's in the staff anyway. B, it's going to be done in a very guided way. And C, it's going to be done to help them to see the parallel in that guiding to people with dementia. So it's about creating a level of emotional competency where staff are able to tap into themselves, because at work they also receive support. So it's even basic things like, what are handovers like? Are they about tasks? Or are they about the feelings that you're going home with? Does someone come in and facilitate sessions about what it actually is like? Give an example. After I've been doing this, I began this in '95, after about 18 months, a care worker said to me, David, do you think I go home to a husband who's person-centred? She said, let me tell you, David, what I go home to. She says, I go home to a husband who thinks I am nothing more than a glorified cleaner of people's bodies. She says, and that's what he thinks my work and his work is. She says, and I go to teenagers who are all off thinking they're going to be off to university these days, and that I didn't make it in life, and I've done nothing with my life. And she said, well, this training's proved to me that I've done a huge thing in my life, and I've learned to be with people, I've learned to give, and she said, but what it's also left me with doing is, I sit on my sofa at home and think, I don't even know if I want to be with my family anymore. And that was a massive warning bell to me. Because that warning bell was, David, you've been delivering all this for 18 months, but you haven't understood, I haven't understood, that there's an emotional cost and consequence to this in a staff team. So that's why I say you have to have a whole nurturing staff at work strategy at a strategic level, which is all about staff support sessions, you know, a whole range of raft, which I have a book called Nurturing Staff Emotions at Work.
You mentioned you've got 6 pilot sites,
Yeah.
pilot care homes in Wales.
Yeah.
Are those principally local authority run care homes? Could you explain a bit about that?
Four of them are local authority and 2 are independent sector. So 2 are in Rhondda Council and 1 in Swansea, 1 in Neath, and then we have an independent sector home in Menai near the bridge in Anglesey, and 1 in Hallmark Care Homes, which is a big national corporate care home company in Cardiff.
And the ones where they're local authority run, are they using them as pilot sites?
Yeah.
Okay.
Yeah, and we're in discussion with a particular on 2 sites there as well.
I feel as a nurse, you know, to practice in a person-centred care way, approach, then we could actually be struck off, and that's what's frightening. And I think everybody here would agree with that.
I began this approach at a care home which was empty and starting, being run by an RMN and a double-trained RMN RGN nurse. That we have a huge network of nurses all working in these project homes who are all obviously registered nurses. That actually today one of my team is working in a nursing home with a nursing team about the shift in nurses this takes. Because it means that nurses have to move from a focus just on medicines administration and management, care planning, and being in the office, and they have to start to move out to model and inspire this on shifts. And I don't want to say this is all nurses, but what I've found with a lot of nurse teams is they don't know how to inspire and model this in a shift and a team. And so it is, I think, a whole area about modernising dementia care nursing. But you know, if you take Rachel Thompson at the Royal College of Nursing, who's backing all this, it will come. But I think you have a layer of nurses at senior level, I'm talking of directors of nursing, who are still struggling and locked into an old culture, which is therefore putting you in an invidious position at the minute. And it's directors of nursing who have to understand that dementia care nursing needs radically modernising. And in fairness to nurses, I think nurses want this, lost their way in it 10 years ago, and want it back again. But it's about senior nurses in organisations grasping this.
I think if a senior nurse came into the ward and I was eating a piece of toast with a patient, then they'd want to know why I was eating that piece of toast on the ward. And yet I can take you to NHS wards where the nurses are tasked with this as one of the prime bits of nursing. And the whole, they've won a national award called the Tea and Cake Strategy. That there is initiatives in nursing that are leading on this, but you're right.
Do people with dementia need nursing care?
Right. The question everyone didn't hear was, in my opinion, do people with dementia need nursing care? I think the answer to that is the same way any of us do. There is a point of all of us in our lives when we need a specialist nursing approach and a time when we don't. The best ever example of person-centred care I had was in cardiac intensive care. I had phenomenal person-centred care towards me, my partner 22 years, and my daughter at the time, who saw us as one whole family with a life history, with this catastrophic event at 46 happening to us, where I was given less than 4 weeks to live. And I saw that cardiac nurses seemed to just naturally realise they had to work with the whole person and a whole family. So back to dementia care, I think the categorisations in residential and nursing dementia care become rubbish. Absolute rubbish. Because we know that people will leave dementia care nursing homes, come to a residential home, their behaviours all then reduce with this model, and then commissioners come in wanting to cut the fees for that individual, who has been in 4 nursing homes on high fees, then comes to a residential home that's practising this approach, and it works for them, and then it's right, now we want to cut your fees because you know behaviours, the care plan's reduced. So we've got a complete mess on the hierarchy of residential nursing homes and what is nursing dementia care. But what I would say is, there is a point, and we've just launched a nursing dementia care 50-point checklist, because for a number of years I've been bringing all this into nursing homes and care homes, residential homes, and I made a presumption that I was layering this approach on top of good nursing. And then started to realise that you can layer all what I've described today on top of a nursing home that hasn't got basic, you know, back to the word basic, hasn't got the basic nursing care in place. Now, so I think, you know, there is a need for nurses, and I think the need for nurses is to lead, take back the territory and lead as inspiring leaders. I think there's a need for nursing care to lead what is really good personal care. But I think it's when it's on its specialist point, and perhaps the later stage of dementia care, when actually really you need the nurse. So I still want the skill mix in homes, but I don't want the presumption just to be that the nurse is always the expert, because the nurse isn't always the expert. So I want the skill mix there, but I want an equalness in the staff team, but I want an acceptance that everyone, nurse or care worker, is training good nursing care, and that nurses lead that, peer review it, but also perhaps as specialists in late stage dementia care. So I hope that's perhaps answered in terms of my opinion.
Thank you very much, David, for that. My mother's had Alzheimer's now for about 8 years, and one of the problems I found is giving her, the challenges is to keeping her occupied in worthwhile events. And she's now in a care home, and I've been doing some crayoning with some of the residents, and only 4 out of the 20 can even manage that. And then last week I went to a friend who had an iPad, and they were using it with their child. And it really excited me about the possibilities of using iPads with people with dementia, like kaleidoscopes and things like that. And I've sort of been looking up, and I can't find anything for memory loss dementia for our apps, but for special needs children. And I'm just wondering, am I going down the right route?
Right.
Because is this just me? This is just me doing this. I haven't read anything up about it or anything.
2 different sponsors. Specifically about the iPad, the touchscreen. There is a company in the UK who developed touchscreen TVs for people with dementia, where you can tap on a picture. And it might be a picture of pets, or it might be a picture of aeroplanes, and so that people with dementia can, in a sense, just scroll themselves through pictures using touchscreens. We're in discussions at the moment with I better not give his name. He's a famous pop artist who is developing an app for people with dementia. So he's going down the road of that kaleidoscope to music route of an app. But wider than that, what I would say is, and I haven't mentioned it in my presentation, that one of the big approaches we use in all the projects is what we call matching, which is if you put a cocktail of people with dementia together in a room, then you drop the care to the lowest common denominator. Because if in the room are some people with early dementia who can be reorientated, and then there are some people in the room who are in a different reality, where you need to join their reality, and then there are some people in the room who are stuck in repetitive expression, which is about stuck feelings that come out as stuck actions. And then you have people in the room with later stage dementia care needs who need intensive nursing and comfort support. And then staff are left with 20 people muddled. No worker can move from person to person and keep switching their skill. So what happens is the skill just drops to the lowest. And that happens also in terms of occupying people. The best chances to occupy people is to group people at a similar point of dementia together, so that you know, people who are in an early point of dementia, that the activities need to be about reorientating, about household work, domestic stuff, running a home. Whereas the activities for people in a different reality need to be joining the man who thinks he's a farmer, or the woman who thinks she's 42 in the red dress, and recreating their realities, bits of jobs they did in the past. But that as it condenses down into repetitive, more stuck expression, I mean, I've used spinning tops, musical toys, a whole range of things to try and get the repetition out through a more positive object than just, you know, just the banging, or the help me, or the picking and rolling. That repetition's coming out in those destructive ways because they haven't got a medium. So back to your iPad, back to all sorts of things, I'd say try any medium to help the person. If it's ripping things, just holding fur, velvet, anything that helps get out the expression. I am going to do the advert at this point and say, you know, we've 8 DVDs, you know, so there are DVDs you can get. You know, there's a DVD I did with the BBC 3 years ago with Jerry Robinson, a 2-hour one. Lots of care homes show that because it was powerful BBC TV. You can get that from us over BBC, but we've produced our own as well. Mattering that I was showing you here has just come out. It's a 4-hour training DVD, 8 themes, where, as you can see, 4 homes and the staff talk about how they went about it. And it's perhaps easier for staff to see other staff talking about it than it is even for them listening to me. If you can't afford any of those, we've got books on it. If you can't afford those, go on our website, there's free articles you can print off, etc. And then, you know, Dementia Care Matters is only one piece of the jigsaw. You heard other pieces this morning, but it is about, I think people need to see it. I think if I just talked to you and I hadn't shown it, and if I hadn't shared anything about myself as well, so I think what I've tried to do in the way I present it to is model to you how to model it to your staff. Share something of yourself, share something of your life, share why it mattered to you, share the feelings you had today to them. Use the handout you've got in the folder from me. Get some clips. Go on YouTube. I've got lots of free clips on YouTube. You can show them clips of me on YouTube. Put together something and try and replicate. Because I don't do this just for the sake of doing it. I am trying to model it to you to say, it's not just a voyeuristic thing that you experience. I'm trying to say, I do it this way, because if you do it this way, this is what transforms staff.